morning and welcome to another episode of Oral Pathology Tuesdays. And today we are going through another one of the perspective series. This is a series that is basically really focused on bringing us hope and giving us new ideas, more insights. It's all about the glass being half full most of the times. But sometimes reality has to set in, and the fact has to be faced that the glass will forever remain half full or half empty, whichever way you want to see it, unless you go and do something about it. You know, we got to go and try and actually fill it. So reality is essential, and a reality check is essential. Towards that, we have a rather large panel today, which itself will tell you that how important this topic is. It's all about change. Do we need change? Well, personally, I think we need change. But it's all about when you think about it, if you have to think, you pause for a moment and think, do you love oral pathology? Um, I think an almost instantaneous answer is yes. If you're here, you love oral pathology. But another thing, another group or another idea, a tenet that is highly loved is capitalism. And the most successful capitalists came up with the idea of destructive creatism, not so much because they wanted to destroy money, but because they wanted to find and constantly come up with ways to create more. And that creating more often requires creating better, greater things, requires a certain quantum of rebuilding, which rebuilding by its very basis requires that we do things again and in a better way. To see what is the better way, and if there is a better way, we have a panel today with us. And yes, on this perspective series, we have two sets of panels who are going to go through this idea is a career-oriented look at the graduate Indian oral pathology training. So career-oriented because obviously, is it really up to the mark for what we want to do today, for what our careers are today, for the service we want to provide today? Because finally, oral pathologists are nothing without oral pathology, and oral pathology is the core to which all of us belong. So, are we doing a good enough job? We have two panels. The first is going to be a combination of Dr. Ravikanth Manyam, Dr. Jayanthi Varun, Dr. Madhura, and Dr. Brendan Dsouza. The second panel is going to be Dr. Ranganathan, Dr. Raghu Radhakrishnan, Dr. Venkat Reddy, and Dr. Simarpreet. And I'm, of course, in the middle of all that. I am the host. And we will go through this. I have to put a disclaimer. Everything we discuss today is our individual views. It is not to say anything that has been done before has not been good. It is just to say what we think is required for now and for the future. With that, and without much further ado, we will start. Welcome, everyone. Lovely to have you all here.
Hi, ma'am.
Hello, ma'am.
Hi, ma'am. Thank you, ma'am.
Hi, everyone. Yes, okay. So, yes, we have everybody here. So, let's start. I think we are going to have the first panel, and the first panel we are going alphabetically. So, we have decided that Dr. Brendan, who is actually involved in oral pathology practice, will be the first one to tell us his views of the current training and what he feels is required. Yes, Dr. Brendan, please take it over.
Good morning, everyone. I'm Dr. Brendan Dsouza. I'm into private oral pathology practice in Mumbai. So today the topic we are speaking on is postgraduate training in oral pathology. So I felt I would share my personal experiences, the difficulties which I experienced after my post-graduation and setting up my oral path lab, and what changes that could have been made by me earlier which would have helped me better in my oral path lab. So, and also the questions which are most commonly asked to me by surgeons. The first thing I feel is that we should have a detailed training in handling and reporting of the resection specimens like the hemimandibulectomy, the neck dissection and all. Yes, we do get cases in colleges where we do report such cases, but to have such a big number of cases to make you confident is important, I feel, because nowadays, as you know, the whatever the oral cancer surgeon, they do resections and all, they are mostly sent to other laboratories, and we ourselves are not very confident. I'm speaking for me in that regard, how to report such specimens, the depth of invasion, free margins, because we haven't done much research or much training in that. So specific training in that regard would help us definitely to actually have and hold us in good stead, so we can also report such cases, and the doctors would be confident to send us such cases. Also, if such a facility is not available in any college, like cases are not much, so there also can be specific centers where they can be trainings which can be done for the oral pathologist, so that he or she, they can learn through it, and also it would definitely help them in the future. The second point I would like to say, the difference which I felt from our training and from our regular oral pathology in our post graduation and in private practice is regard to how we report cases. So in college, we are always taught to report cases based on to mention all that we see. We have to mention all the findings. But in private practice, we are usually reporting uh, based on the diagnosis is more important, apart from the findings and all, because the surgeon, they never go through anything which we have written. They only are interested in the diagnosis. So a detailed and a specific reporting, to the point reporting, like surgical based reporting is important. That is what I feel. uh, Also, the third part I would like to speak on is training in different molecular biology techniques for the postgraduates. So, like IHC, like we had done IHC staining in our colleges, PCR, ELISA. So this would also open up a new domain for the oral pathologists. So even they can have a career out of that. Those who are interested in research can have a specific, if they have specific training in these subjects or in these techniques, they may also be able to find a new career or a new direction for themselves through this. So these are the things, as ma'am said, there is nothing wrong in our oral pathology syllabus or the curriculum, but these are the things which I feel, if included, would definitely help us to grow better and also have better future opportunities. Okay, thank you.
Thank you, Brendan.
Thanks.
That was crisp. I think since we are going alphabetically, may I now invite Jayanthi to open this discussion.
Hi everyone, a very good morning to all of you. When we talk about the current oral pathology graduate training or curriculum, most of the institutions across the country, they follow the curriculum that is given by the Dental Council of India and to some extent by the university to which the colleges are affiliated to. The good and positive points of the current curriculum and training program is that it covers almost different aspects, starting from the basic histology through general pathology, microbiology, oncology, laboratory techniques, even forensic odontology, research methodology, as well as molecular diagnostic techniques. So an individual graduate, based on his her or his interest, has to decide which particular topic he has to take for his career options. Because our subject is very dynamic and evolving subject. We have lots of career options, not only in academics, but also in research, and as Dr. Brendan said, practicing clinical oral pathology. Now, I am practicing clinical oral pathology at my private dental clinic in Trivandrum. And from my experience, when a patient comes to you or is being referred to you for a diagnosis, most of us in our institutions as a postgraduate student are trained to take a proper history and arrive at a proper clinical diagnosis, but we just stop with that. But when you come to the real world and face the real world and see the patients there, you have to move to the next level. Most of the times you might be able to diagnose clinically, but not all the time. So you might have to rely on other investigations to arrive at the final diagnosis. That might be a orthophantomogram or a CBCT or a CT scan. So we should be able to guide the patient to help them to ask for the correct investigation, and not only that, we should be able to interpret those investigations correctly to arrive at the diagnosis. So at the postgraduate level, it's not just enough that we do a clinical diagnosis and stop with that. We should be able to interpret all the latest available investigations. I think more emphasis has to be given in that aspect. And we just don't stop with diagnosis. If everything gets complete only with the management, so as a general dentist or as an oral pathologist, you should be aware of all the latest management techniques and treatment options available for that particular lesion you are diagnosing. So most of the time you will be able to do the treatment. Sometimes you might have to refer them to the surgeon. So you should be also able to guide the surgeon as to what kind of treatment will be better in these cases. For that, you should be aware of all this and should be able to do it on your own. So when you want to confidently and practice clinical oral pathology, I think we should not just stop with clinical diagnosis. We should also have adequate training on investigations, interpreting them, and also managing the patient and treating in the right way. And the second aspect is most of my colleagues and some of my juniors at college, they are having a oral pathology laboratory of their own. They are running a successful laboratory where they do tissue processing and report oral pathology cases and oral lesions. So when you are confident enough to run your own lab and give a report, every one of you will agree with me, including the seniors. Now we have moved from a simple histopathology to a molecular technique. Most of the diagnosis does not rely on only histopathology. Many times we require techniques like immunohistochemistry or polymerase chain reaction to arrive at the diagnosis, and molecular markers have become a very important part of pathology diagnosis. And we all know that our students are well aware, the postgraduates are well aware of all these techniques. Theoretically, they know everything. But are we giving them practical training? It's not that they should know how to do it, but they should know the principle behind it. They should be able to troubleshoot it, and they should be able to interpret the results properly of these techniques. And if they are aware of all the techniques and know how to do it, many of the institutions are now having a separate research lab. I think Dr. Raghu will agree with me, Dr. Ranganathan will agree. Most of the institutions have a separate research lab, and these oral path graduates who are confident in performing and interpreting these results can be employed as a research trainers and research student associates there in that particular laboratory. Even recently, Vinayaka Mission has started a research laboratory, and one of the oral pathologists has been given in charge of the research lab. So when we are adequately trained, sufficiently trained, automatically we become confident. So when we become confident, then we will get all the opportunities and career options. So I emphasize here clearly to practice clinical oral pathology, not only to see the patients, to run your own lab. I think more emphasis has to be given on molecular technique and investigations and management. These are my points of view, and from my experience, these are the points that I wanted to state.
Thank you, Jayanthi. You've stolen all the points that I wanted to speak. So now we move on to Dr. Madhura.
Thank you, sir. Hope I'm audible.
Yes, you are.
Yeah. Hello, everyone. Very good morning to all of you. Considering the curriculum of a postgraduate course as satisfactory, here are some of my perspectives to have a career in the field of oral pathology and microbiology in Indian scenario. With the changing needs, there is a growing demand for improvisation of the postgraduate training. Having continued to contribute to 3 domains of the profession, such as academics, clinical practice, and research, I shall express my opinion to fine-tune the training of oral pathology and microbiology. In the academic domain, training in the concepts of education methodology is very important, which enables us to become good teachers. Knowing how to teach is very important. We, the oral pathologists, spend a lot of time teaching our undergraduates, postgraduates. We also guide the students of fellowship courses and research scholars of PhD programs of various institutions. Getting a sound knowledge about a variety of teaching learning methods and also the media will help us to cater to the needs of the learners. For example, we take didactic lectures, how to make these lectures more interesting. That is, how to make teaching learning more interesting is the greatest challenge for the teacher. Incorporation of the various teaching learning media and methods, say it could be a simple lecture, a seminar approach, or a case-based learning, or problem-based exercise. So to use different methods, definitely will enhance the process of teaching learning, making the learning process a joyful experience. Then moving on with the arm of clinical practice, there are two aspects in this. An oral pathologist who can practice general dentistry, and he or she can also do a specialty practice. Considering the practice of oral pathology, again, there are two things in this: providing consultancy services, which we are all doing in the college, and also establishing a diagnostic laboratory. I provide consultancy services at various dental clinics. So training the postgraduates in establishing their own diagnostic laboratory is a need of the hour. This training will include the reinforcement of the learned techniques, such as performing the vital staining, different types of biopsy, and FNAC. Then, confident signing out of the reports for lesions of oral and paraoral region. This also includes the signing out of the reports for larger resected specimens, especially for marginal clearance. Needless to say, this entire training has to be robust. In addition, I emphasize on the training in the molecular techniques, say polymerase chain reaction or in situ hybridization and such others, to use them as diagnostic adjuncts. Moving on with the research arm. The concepts of research methodology taught in the postgraduate courses fine. There has to be an additional training required for translation of the carried out research into publications, patents, and for industrial collaboration. Considering the number of chemicals, the techniques, and the tools that a postgraduate trainee deals with, there is a huge scope created towards innovations, patents, and industrial collaboration. For example, looking at biosafe alternatives to some of the hazardous chemicals what we use in the laboratory. The principles of research learnt well will improve our focus to become good academicians, clinicians, and of course, researchers. Hence, I think, taken well, trained well, and pursued well, we have a bright future in oral pathology and microbiology. Thank you all.
Very good, Madhura. Now we move on to Ravikant, please.
Yeah, so thank you very much. Good morning, everyone. I wanted to share my understanding and my area of looking at the things beyond the present oral pathology. I would like to share with you all. As the oral pathology is a specialization on its own, and we deal with a lot of subjects in this oral pathology specialization, especially if we talk about oral microbiology, forensic odontology, oral biology, similarly the regular oral histopathology, in addition to all these topics. So the way we actually restrict ourselves with only the oral histopathology, whether it is the molecular aspect or with the immunomarkers, but still I understand as a specialization, we are confining ourselves to only a certain areas of the oral pathology. But much beyond this, we can able to actually catch it on. I think we need to do a lot of brainstorming sessions to understand where we need to improve on. To put forward in a step-by-step manner, I'll just come off one after the another from the beginning with forensic odontology, for example. So this is the branch of it on its own, in fact, forensic odontology, but as oral pathologists, we teach the undergraduates and postgraduates, we train them in different levels, but not exactly like a person who is actually skillful in tackling practical aspects of forensic odontology. So we need to have, because there are some courses already going on around MSc forensic odontology by different universities. Now, till some time we were thought about, okay, oral pathology, when someone actually finishes it, I think they have an added advantage in relation to the forensic odontology. But as days goes by, the differences are becoming very narrow. In fact, we need to get updated in the recent advances in the forensic odontology. So we need to get trained. So after the oral pathology, we really need to concentrate on some specialized areas by itself. Similarly, the other ones are oral microbiology. In fact, the entire oral flora, when we deal with, when we're studying about the infections or when we study about the oral pathology in general, we understand oral microbiology itself is a huge area on its own. But the amount of time and the research we spend on oral microbiology, though we call oral pathology and microbiology as a branch of what we deal with, but the concentration on the oral microbiology, I feel it is definitely very minimal. We don't find, in fact, I did not know except one or two faculty who are actually involved in oral microbiology in our country. Other than that, I would like to see a oral pathologist actually having his passion in oral microbiology and start working in those domains, in fact. So we need to find, understand, and also equip ourselves with the necessary technological and the infrastructural abilities. So tomorrow, if someone from the oral path wants to undergo a special training in addition to the 3-year program, if they could find a place where, okay, I can learn, update myself, and by career, I can actually start looking at microbiology as my own, because I find enjoyment in that particular area. So similar to that one, oral microbiology, oral biology itself, we deal with the molecular aspect of tooth development, molecular aspect of dental tissues, theoretically, in fact, but we learn it in much detail. But when it comes into the practical aspects, or when it comes into as a career option, how many of you we are actually confident in looking at oral biology as an option? Though there are good amount of research taking place in India. I'm not comparing with other countries, but definitely there is a good amount of research on biological aspects of the basic tissue levels. In fact, to the dental tissues, in fact, what I'm trying to say. But as a career, again, oral biology, it gives a lot of avenues. In fact, from the time the enamel molecular aspect of from the developmental side to the restorative aspects, similar to other dental tissues. But we learn those dental tissues from the embryological aspect to the molecular, microbiology, microscopic, electron microscopic, every aspect of it, we learn them from a theoretical background. But ultimately, what happens, how many people are actually having a career directed towards some research or academic or in whatever the forms in these dimensions, especially the oral microbiology or the oral biology. The other one which I wanted to add here is the dental anatomy areas. In the dental anatomy area, we deal in much detail about all the morphological aspects, different occlusal related topics. We also deal with it in a much extensive manner. But when it comes to the rehabilitation of a patient, or when it comes to managing a patient that has an occlusal discrepancies, or where the occlusal management is a must. So this entire theoretical knowledge, entire information, what we are actually giving it to the students, I feel we are actually missing it when it comes to the patient's part of it, when you're dealing with the patient's part, or when it comes to the research part. So since this is a specialization on its own, I think I understand that there are limitations. Everything cannot be learned under the 3-year program. Our DCI, our university curriculum, whatever it is been designed, it's a comprehensive design. It's a very nice, absolutely, the entire information is being mentioned there. So it is only after this 3-year program which we need to look for the places where we need to update ourselves, places where we need to learn beyond the regular postgraduate training. So I feel in India, especially in our situation, in the future coming days, as the evolving of molecular techniques and the other tissue engineering levels, I think the oral pathologist has got much more things to do, looking at his basic level of learning in the 3-year course, and provided a right facilities and opportunities. That means we need to first of all identify centers of excellence in these mentioned areas earlier. So oral microbiology or the oral biology or other areas where we deal with, if we have some centers of excellence, I think the perspective of oral pathology will be beyond the the present levels. I hope I conveyed the points. Thank you, sir.
Thank you, Ravi. Over to Mandana.
Yeah. Thank you. Thank you, Ravi. Thank you, all of you, in fact. And thank you, Raghu, for carrying it this far. Well, now, since you're back in the panel yourself, I will take over from this point, but please chip in case I've forgotten something. So I think the first thing now if I may invite the rest of the panel to please put on your cameras and your mics. Yes. So to sum up what we heard from our panel so far is that certain things which came up, and some of it came up with emphasis by all of them. One is that we need better training in oncopathology as a whole. And I think the second one was that there's a gap between the real life and the academic oral pathology. The kind of reports we write, the kind of training we give our students so that when they go out and what they need to do, and we need to possibly tackle that. Another thing is to redefine what is the basic techniques. And because basics have obviously changed. Like I was saying the other day, basics at our time was HNE. Basics today is an entirely, and our time, basics was HNE, at once was IHC. I think today it's an entirely different ballgame. So we need to change that with time. Dr. Madhura made some very interesting point on teaching methodology. Yes, of course. I mean, that is something that could help for those who are going in academics, because if we think about it, to teach a primary school, you take a special course. But to teach some of the highest degrees, we don't really have any teaching courses that prepare us for that. So that is another thing. And then, yes, there was this thing about all the other components that come in our degree. And we're given I would say, a stepchild treatment is the oral microbiology and forensic. So where do we stand with those? How much more do we need before someone who goes out with a degree that also says oral pathology and oral microbiology is equally confident to complete a career or to continue in a career in microbiology, oral microbiology or forensic? And of course is the concept of oral biology, or what we have as our, what short form we used to say, DADH, which is quite extensive, is oral histology. If I'm not mistaken, it is oral histology, physiology, embryology, anatomy, and tooth morphology, and possibly some things I missed because it's a very long name, and everything under the sun. And it's really quite extensive beyond what we already need to do as oral pathology, which is, I think, one of the most vast subjects, or the vastest subjects that we have within dentistry. So that is another thing. Where do we stand on that? How much of it is essential? How much of it should be provided as additional training? And where should we go with that? Because we need to be able to do justice to that subject as much as we do to oral pathology if we are the caretakers of, let's say, oral biology. And the last one is the possibility of additional training. If someone wants to go into specific areas, how much, I think the thing about getting special training is how much should be in our basic training and how much then should be an additional training that someone should take. So now with these, we'll open the topics for discussion. And I think we'll go with the very first one. We'll just take them as they came. So, and any of the panel who wants to speak on any topic, please just chip in. So I think the first one is, how do we deal with our shortcomings, or should I say the additional requirements we need in oncopathology? Yes, it's open to you all.
Yeah, thank you so much, sir. Good morning, sir. Good morning, everybody. It's wonderful to be here today. And yes, there's a piece of advice I got because, it's been 20 years and I've been trying to, redirect, because also that I'm in an area which I kind of come as the second senior most oral pathologist, which is rather funny. So I need a lot of direction. So I got a piece of advice which said that, yes, for oncopathology, first of all, you have to delineate where you want to after you get your basic degree, which is like a very nicely structured course. So from there on, we need to move forward and decide our area of specialism, that where we're going to concentrate on. And there are a lot of opportunities where I think we need some intervention into the regional cancer institutes. There are fellowship programs, and I've been trying to follow, almost go through all the forms and everything, and there is very little availability for the MDS oral pathology, even if it's an oral cancer. And oral cancer burden, as we all know, we are emerging as the capital of oral cancer. So a lot can be done into getting into there. And before that, maybe competency. So if you're choosing, you have to first of all decide you want forensic odontology, you want, you can't be a master of everything. So my humble request is to choose what you want to excel in. And even if it's oral cancer, you want to go into prevention, you want to go in for the molecular techniques, because you can't master everything. I tried doing that, running in different directions. And I finally realized, after much deliberation, that prevention is where I need to focus on. And also another thing, there is a lot of opportunity. Believe me, it's just that we need to explore. Like, I'd give you an example. 2 years ago, when the conference happened in Amritsar, that was the time we approached ICMR. There was no opportunity for oral, there was one of the girls who's an oral pathologist in Delhi. So I know Raghu knows her, Gurkiran, right? So she pointed out to us that, to IAOMP, that, there is no, ICMR is not considering oral pathologists. And from then on, ICMR took notice because the representations were sent to them. And ICMR is, started involving the oral pathologists and their inputs. There are a lot of people who are not aware of our specialism. So if we go and, contact or, have a rapport with them, I'm sure a lot of things are going to come into it. And also another piece of advice is competency is also required from our end. We need to really, really put in after your degree, you need to be competent, you need to define your role, and then you need to be very, very persistent into working in that domain, because when you deal with people, you better do your homework and go and talk to them. And I'm sure there are people, even in, I think, Tata Memorial, they'll be more than happy. They're opening up their regional Tata Memorial centers everywhere. We have one center in Sangarur, which is Punjab, and they were very, very keen on training. They want to get into collaborative training for the general dentist also. So, I've come across very keen colleagues from the other specialisms who are ready to work with us. So I think that is one opportunity I feel has huge potential. Thank you.
Right. So who would like to comment next? Let's see, Dr. Reddy. Your mic is off.
Thank you, ma'am. Ma'am, actually, as far as the training program is concerned, as we know, it is like 36 months program. It's a total of 3 years. But I strongly believe that out of this 36 months, the first 12 months should be dedicated to surgical pathology, hematopathology, cytology, autopsy pathology, dermatopathology, frozen sections, microbiology, and genomics, and etc. I think for this purpose, we can post our postgraduate students into the departments of general pathology. Then, after this 12 months of vigorous training, the rest of the 24 months, we can devote the time to oral and maxillofacial pathology. And this oral and maxillofacial pathology also I believe that it should have a major three components. One is clinical component. It is already included in our curriculum, but most of the institutions, as far as my experience goes, we are not following it meticulously. The clinical component where we should have a thorough knowledge of clinical diagnosis and as well as biopsy taking. This we are not, this is already included in our DCI curriculum, but strictly speaking, most of the institutions are not following this. Then second one is microscopic component. Of course, everybody is following this. There is a correlation of gross, clinical, and radiographic features with the microscopic features. I don't think, I think we are strong enough in this. And third one is really we should focus on this, that is research component. That is research-oriented training where our residents or postgraduates are lacking in this aspect. And also emphasize that our postgraduate should gain or should acquire additional skills like advanced diagnostic techniques, molecular techniques, and a thorough knowledge of forensic odontology. Why I am stressing upon forensic odontology means maybe in near future, our policy makers may start a separate branch of forensic odontology, at least a separate subject at third BDS level. This is already there in the proposal since long time, but I think maybe shortly it will come into the force. So oral pathologists with good knowledge in forensic odontology may get good job opportunities to run those departments. So these are my perspectives, madam. Thank you.
Yes, perfect. Okay. So since we went in this direction, I think I'll let Raghu go and then we will let Sir wrap up. Yes, on this point. Yes, Raghu.
I think, thank you so much, Mandana. Dr. Ramana Reddy has summed it up really well. So I think we need to train our oral pathologists to be surgical pathologists. And I can tell you, based on my own experience, being in the University of Sheffield, the first 6 months, the students spend their time in the pathology museum and they train with the general pathologists. I think that was Brendan's concern, that we are not adept at assessing the margins of a surgically resected specimen. So as a result of which all the specimens go to the pathology department. So I feel everybody takes a lot of pride in the curriculum being vast. But in my opinion, I think it's time that we actually decompress the curriculum and redirect the curriculum towards the production of a clinical oral pathologist. I think we also need to reform the clinical education environment, and then there has to be a lot of focus on the use of technology, including informatics and simulation. So these are some of my observations. The most important thing is you'll have to retain the interest in pathology students by exposing them to the patients and the systemic manifestations from the day one to the last day of their training. And it is also important that they enhance their chairside skills and spend less time doing the diagrams, the carving, and some of the preclinical training, which is not something that they're ever going to practice once they finish their training. So I think these are some of the concerns that I have, and these are some of the areas that we could look into.
Yes, thank you. Sir, now it's to you.
Okay, a very good morning to you all. First of all, Dr. Mandana, thank you very much. I think this has been discussed multiple times in different forums, including our National Association. The Apex organization, Dental Council, is extremely interested in this. And makes my job easy because I think pretty much everybody covered everything. But let me tell you a few problems which you may run into are, the first thing you need to understand that each country is very unique. You cannot transplant the methodology of one country to another country. But I totally agree with what Dr. Raghu said. Exposure to general pathology is absolute must. I think almost all good programs have an exposure to general pathology. I think the Dental Council in its wisdom, that's why it has what's called the extramural programs. We're supposed to send our students to dermatology. We're supposed to send them to oral surgical postings. So that actually sort of covers it. But I think making general pathology a little bit of a mandatory in every program would really help, because you need an idea of general pathology to be a good oral pathologist. Plus, you come into contact with general pathologists, you create a network, they depend on you, you depend on them. So that's a good career move, actually. So that's very important. Let me quickly sum up some of the common things and individual concerns actually here. I'm audible, right?
Yes, sir. Yes.
Yeah, awesome. I think everybody agrees that there should be a clinical component. I think that has been the emphasis of all the speakers. They say clinical component is essential. And I think it's high time we made that very, very clear. And the program which I run has a very strong clinical component. And I'm sure you've heard my presentations, and I would never do a presentation without a clinical slide, because that's at the end of the day, you need to benefit patients. Let me quickly address each of the speakers' concerns. Dr. Brendan, and I think Dr. Raghu also made a point of this, surgical oncology. You need to understand that that's highly specialized. And the reason why many centers don't train oral pathologists is because the oral surgeons don't do these surgeries. So if you do not have oral surgeons in an institution who are not doing any of these head and neck surgeries, obviously you're not going to have a chance to do that. So that's why I think all the other speakers emphasize that we need to go ourselves and train ourselves outside on that. So that's pretty much the state of affairs at this point in time. So because the oral surgeons do not do that, we need to train ourselves with the general surgeons or the onco surgeons. That's the take home on that. And I think the other point Dr. Brendan made was, it's a very important point, and I think we need to touch on that. He said, when you write a report outside the institutional setting, you do not have to be that elaborate. Actually, Dr. Brendan, you need to be very, very careful, because the report is not only for the clinician, that's a legal document. So if you're going to get second opinion, you need to cover all your bases, be extremely clear. So you needn't say what type of lymphocytes, or you needn't do it to what level we train the postgraduates so that they fine tune their skills. The report has to be elaborate, because I do understand that the clinicians get, very restless reading a long report. And you can just put a comment section to what the clinician needs exactly to know. But your report should be detailed, not that detailed like what we teach the postgraduates when they begin their career, because this is a legal document. And many years down the road, if there is any discrepancy, the only thing you can depend on is not on your memory, but what has been written and signed by you and your colleagues. So you need to be very careful about oversimplifying your reports. Be a little bit careful. And I think Dr. Jayanthi made a point of, once again, she's a good clinical pathologist and why clinics are very important. And some of our colleagues are running laboratories, and that's one way to go. And Dr. Madhura, I think, made a very important point, and I think a lot of us are exploring that. In addition to what the other speakers said, patents and industrial collaboration. That's a way to go, actually. And there are a lot of young dentists who are doing that. Some of my colleagues in my institution are actually pursuing patents and doing industrial collaboration. Now, we ran a recent study in COVID, which is going to be published regarding doing a rapid antigen test with saliva. And if you can sort of collaborate with ICMR and other industries, and you separate grants for public-private participation, and industry, the DST, DBT, all of them have a grant where you can collaborate with industry and go for your patents and things like that. So that I think is a very important point Dr. Madhura made. And let's see, Ravi. Ravi actually emphasized on what Dr. Mandana mentioned and what Raghu also alluded to. Oral pathology is very vast. It is vast for a particular reason, and you need to be careful about this. And I think Dr. Mandana made a point of this. You have histology, you have dental anatomy, you have dental physiology, all this goes into dental biology. If you take a step back and think, actually oral pathology is your normal histology, your normal anatomy, your normal physiology, and your normal biochemistry gone wrong. So if you do not know the basics, you can't practice pathology. I mean, that's the cross you have to bear if you choose pathology. Without a knowledge of basics, it's just not going to work. So it's not vast by default, it's by vast because of a particular reason. And if you look at your entire program, if you take a step back and look at it, it's an inverted pyramid. You learn general anatomy in the first year, and then you do the oral anatomy and histology, and then you learn specific surgical anatomy with the surgeons who treat applied anatomy. So actually, the amount of dental anatomy you're supposed to learn or read or make yourself aware of as a pathologist is only very focused to your area of specialty. But you need to know everything. See, because if there is a metabolic disorder and you have an oral manifestation, if you're absolutely not aware of it, it's not going to work. But that's it, like, you know what they say, it's the nature of the beast, or the nature of the program is like that. So you cannot do away with basics. But do understand that the entire dental program, if it is followed as it is being sort of prescribed or put up in your syllabus, actually it's an inverted pyramid. You go from very broad knowledge to very focused knowledge in oral pathology. And you need to have a knowledge of all these. Otherwise, it's going to be very difficult to practice pathology. And that's probably one of the reasons why people don't take pathology, because it's so vast. And that's why some of us who are passionate take it up, because it's so vast and so exciting. So the two sides to the coin. And let me see, did I miss out anything? Dr. Mandana? Forensic odontology. Yeah, yes. Quickly, I'm sorry about that. Forensic odontology. Yeah, it's a good thing that we look at it. The way to look at the oral pathology program is to look at general medicine. Let's take an analogy with general medicine. You could do general medicine, and then you can go on to specialize in renal medicine. You can go on to specialize in neuromedicine, neurodegenerative disorders. I mean, nobody stops you from doing that. So the oral pathology master's program gives you an idea of what you're capable of doing, makes you very proficient in handling diseases of the head and neck and signing out cases. It stops there and gives you an idea of molecular pathology, forensic odontology, and all its branches. Now, it's up to you to follow what you think is going to help you in your career, what you're passionate about, what drives you, and then take it forward. So I think that is why PhDs are becoming popular. There may be very many reasons why you do PhD, but the actual reason is to take on your specialization to one different level. That could be one way to do. And I know there are institutions which combine your master's with PhD now. Very few institutions in the country. I know there's one in Tamil Nadu which does that. So you could join your master's and then continue in your area of interest with your PhD program. Okay. Let me stop here and then hand the mic over to you, and please go ahead.
Yes. So I think to sum up, one of the things is that almost all the points were covered by everyone. And we are all essentially in agreement that there are certain things, and all these things are essential. But the fact remains that yes, as perfect or as complete our syllabus is currently, and it covers all this. So it's literally like a very complete and comprehensive legal document that leaves nothing out. So therefore, nobody can raise a question. It's almost like that, which is fine. And I know it forms the basic minimum. Nobody really stops anyone from teaching more. So that's fine. But what we need to now think, if we are talking about these points and these things that need to be definitely are required, maybe have not been covered equally everywhere. There are definitely centers in the country who do an excellent job right now and whose students come out very, very, definitely very capable of handling all of these things we spoke about. But we are not talking about those and those individual institutes. We're going to try and reach a point where everybody reaches that basic minimum. And I think today, if we could work on what is that basic minimum. Now, for example, we have talked about surgical oncopathology. It is true that if a general pathologist comes out and wants to do more on oncopathology, they will go ahead and, of course, join one of the dedicated institutes. But they do learn a certain basic before coming out. more than anything, I think if you have not learned the basic, you don't really know if you're interested enough to go ahead and do more. That basic information is required. So if we are thinking of that basic information being required, the question is how much. And one advantage we have in this generation, I think, which was not there in the previous generations, is today we can sit here and we can learn about surgical pathology without moving an inch. There is so much that is available. You could be, in somebody else's pathology lab via the web. You don't even really need to be there, to watch the whole thing, see how it's done, get a certain amount of online training or whatever. But what about setting up? Now we agreed, definitely oncopathology is required. A certain level of basic ability, expertise. So where is that? Can we set that basic level of expertise? That when our students come out of postgraduate training, this is the basic level of expertise that today is required, may not have been required 10 years back. Today. Yes, I'm going to just let everyone take it. You please speak and then we can all wait. Yes. Who wants to go with this?
I think Raghu wanted to say something. Raghu?
Yeah. I mean, Mandana, I think it's important for us to take a step back and then see what are the strengths, weaknesses, opportunities, and threats to the profession itself. I mean, if you are questioning the training itself, see, there is a progressive increase in the training capacity over the last 2 decades, particularly with the participation of the private institutions in imparting oral pathology training. And that has also resulted in a substantial increase in the output of qualified pathologists. Yes, as far as the current training itself is concerned, there is a strong emphasis on the theoretical knowledge. And now I think there is also a greater emphasis on the clinical pathology and the clinical pathological correlation before signing out. But then let's look at some of the weaknesses in our oral pathology training. Yes, I think most of us agree that there is a big disconnect between what is learned and what is practiced. And also, if you look at the appointment of the teaching positions, it's only to fill up the regulatory requirements, and there is very little emphasis on the competency of the teaching and the competency of the teachers or the merit. And also, I feel that majority of the practicing dental surgeons who hold teaching positions will do very little justice for their appointment as postgraduate guides. I'm not generalizing it, but then there is very little time for them to focus on the postgraduate training. Let's look at the opportunities that we have. I think there is an opportunity to optimize the performance. And also, I think we need to improve the quality of the oral pathology workforce itself. And also, I think it is important to modify the teaching methodology, which Madhura pointed out, and also introduction of the research in curriculum. We just do it for the sake of completing our dissertation. So these are some of the opportunities that we have. We'll have to optimize the performance and we'll have to improve the quality of the oral pathology workforce. We have to modify the teaching pedagogies. And also we have to introduce the research in our curriculum. But what is the threat right now as oral pathologists? A fledgling oral pathologist in India will only lead to wastage of manpower. So this is really worrisome for me. And this may also in some ways create a threat to the professional integrity. And I'm also seeing that the current attitude of the people, the faculty, the students to oral pathology as a profession itself is worrisome. So before we get into what should be the optimum training that a student has to receive. I think, if we can address what are our strengths, and if we can assess what are our strengths, and then address what are our weaknesses, and then see if there is any scope for improvement for us as a profession. You have a think tank, and then you propose a policy, and then take an evidence-based approach. So that way, I think you will be able to bring out the best in the oral pathology training in the country. And yeah, I mean, over to you, Mandana.
Yeah, they are very valid points, and definitely something we will have to take over a discussion on another day. But if we try and handle everything all at the same time, we will not really reach anywhere. So let's just, for the sake of of proceeding, assume that our that we have all the required infrastructure, and our methodology of teaching and evaluation is perfect. Let's just assume it, okay? And then if we just Ranganathan sir made a very good point. Like, for example, even just coming on the terms of the surgical pathology, yes, so many colleges don't have it. So how do you teach your students? It's true. But if we could decide, I mean, colleges don't have a number of other things too, and then we decided that they were necessary, and we used to teach it. Somehow we used to send them out, we used to have collaborations, we used to have workshops, so many things that happen. If today we could decide on what is essential between us, and I'm not really presumptive enough to think that this one meeting is going to really make a world of difference, but I'm hoping it will get discussions going. So if we can decide on what is required, and with the best idea that, oh yeah, we can make it work. And then we work on, once we have that decision in place, then we work on how to make it available. And also then we work on how to make it equal, so that we have a uniform system around the country of evaluation and of training, or at least the best minimum possible across the country. There will always be differences. There is no country that has managed to ever overcome that, and we are not likely to either. So let's just focus on what is necessary today. Today's situation, today's graduates, what do they need? What is the basic minimum we need them to know to come out and be confident to be able to get into the workforce, whether it is into academics, whether it is into research, that basic. Nobody expects them to come out and be absolute experts, but we expect them to come out and be reasonably good. I'm always very fond of what the Consumer Court used to say, a reasonably good doctor. So we come up with that reasonably good, a reasonable level of expertise, which would be required if you come out and say, I'm a master of oral pathology, microbiology, and I think sometimes it's included forensic dentistry. So what is that we need? Where do we stand? Can we work on coming with that? Yes, sir.
Actually, that's not very difficult, actually. That's a very straightforward question. If you put it that way, it's not very difficult. Okay, let's address each question. Like, for example, let me talk about my program here. What do we do to train them in clinical context? Simple. At least a minimum of 25 cases they need to record. And if they do it, that's fine enough. A lot of international institutes do the same thing. Surgical pathology, having said that, many institutions don't do that. You're aware that it's mandatory that all dental institutions should have an attachment to a medical college. You could work with surgeons who are working there and at least sign out 2 cases of neck dissection. And by the way, neck dissections have become very conservative. Very rarely do people do massive surgeries, unless, of course, it's in stage 3 or stage 4. You could do that. So say like 2 cases of gross dissection, you may have to at least gross up by the time you finish your postgraduate program. And we make it mandatory, and it's there in the DCI regulations for the students to take classes for the undergraduates. So they're trained in that, so that we know that we guide them as to how to exactly teach and how to present. That's stuff taken care of. Microbiology, you could have a posting for about a week or 2 in any of the diagnostic microbiology around the country, or in your medical college to which you're affiliated to, or which is there along with the dental college. That's not very difficult. And same way you could have postings in molecular pathology. Almost every institution now does immunohistochemistry and PCR. If you do not have it, the medical college will have it. Say at least 2 PCRs, at least 2 infectious disease, you please record in your logbooks before you graduate. So you could just add on these exercises and add a theoretical component. And we do dermatology posting for about a month, in addition to general pathology posting and microbiology posting, So, and we do microbiology. So we have one within the medical college, so that we could always do along with the hospital. So that's not very easy to define at all, actually. But mind you, I do not know by definition, do you want it to be put in the curriculum? It is there. I mean, each institution could define that for themselves, say this many cases of forensic odontology you need, this many cases of an infectious disease, and these 2 cases with radical neck dissection or limited neck dissection. That's not difficult to implement at all, actually. And our university makes it mandatory to take a 3 or 4 days program on research methodology by the first year students. So that's taken care of. We expose them to that. And a lot of institutions do it. For example, I know Shibar has done a lot of programs of research methodology almost every year, of which I have been one of the members. And they have invited ICMR, colleagues from ICMR. And we did that in a national conference. In fact, we brought in the ICMR at Ramoji City when Reddy did the conference. And I was very unpleasantly surprised to see there were 10 people sitting in that. But that was many years back. People maybe now, if you do it, it may be a little bit different because people are passionate about research and it is relatively easy to access by high throughput technology. Lastly, let me conclude by saying that you need to network and collaborate. Everything can't be in the same institution. It's just not physically and financially feasible. And once again, that is why the association has a student exchange program, which many of you are aware of. Some years it's implemented very effectively. Maybe in a situation like now, it's not effective. So where you can actually send, if you're a member of the association, you could exchange with an institution which has got facilities which you don't have. And that system is in place. You just need to use it. That's it. So it's really not difficult. I mean, you could pull out all these specialities, which we said, for example, patent. We ran a 2-day course on patent. Then somebody came and spoke about how to do patents from the patent office. So you could actually list all these and give a minimum number of hours, like what many international program does, credit does, which should be absolutely implementable. I don't see any reason why it shouldn't be. Absolutely. So if you can just sum up whatever we did today and put it up on your website, I'm sure people will use it as a framework to go ahead. I'm pretty optimistic about that. So it is doable. It's very doable.
It is very doable, but somehow we haven't done it for a very long time.
Mandana, it's a question of who will build the cat. It's a question of who will build the cat. I mean, you need to set up and say, see, this is what our program does. If anybody wants to follow, I think each of our institute is following that. I mean, in fact, myself and Dr. Reddy had a huge discussion yesterday about a huge multi-lakh project which their institution got and how to do it in the oral pathology department. It's being done. I think the basic problem with us is, and I make it in a very, very nice sense, we tend to not advertise what we do. And we just tend to be limited to our locality. And I think programs like this with you at the head actually can bring that out. And if you can have a program which says each institution which has got a funding or granting, please tell us what your experience is. Or an institution which is doing forensic or odontology, what your experience. Take out each of these which you spoke today. And you can run a program on that. And the other institutions can learn from that for research, for forensic, for surgical oncology. I'm sure there are institutions which, because I have visited them in my capacity as inspector and examiner, and some of them are doing amazing work. And sometimes I realize I don't even know that, that much work is going on in another institute. Leave alone that. If you take an institute, many of us in pathology don't realize what's going on in a neighboring department. Now I know my endo department does PCR, does microbiology, they do microbiome studies. And I have the privilege of knowing it because I sit in the ethics committee. Otherwise, I wouldn't even know my colleagues in my institution across my corridor are doing this. So I think in addition to the opportunities which Dr. Raghu mentioned, collaborating with your own colleagues within your institution, because many of them don't have a centralized one. It is becoming centralized. I do realize that. And some of us are by nature inquisitive. Every time I meet a HOD of another department, I ask them, what are you guys doing? What research you're doing? So it's I think it's basically an individual style of working. Sometimes you got to do that. You have to get outside the microscope and talk to people, network, attend conferences, attend programs like what you're conducting, so people really know what's going on. And I think you made a very important point that today you can sit in front of your computer and access all these. I mean, I feel jealous of this generation. And I remember when I was doing my master's, and now you'll know how ancient I am. I used to write to Instock to get articles to Delhi, and they had to be mailed back to me. And I have used something called, cyclostyling, which I don't think this generation even knows what it is. So you have access to fantastic information. So it is a question of too much information. I feel that's sometimes the problem. So you need to sit back, not get carried away by this deluge of information and say, like you rightly said, this is the basic minimum we need. And this is what we have listed. If somebody needs to add to this list, please add. Please tell us your experiences. And I'm sure we'll do great. I have no doubts about that. Okay,
so I think one way, sorry, Simar, please.
Yeah, I do agree with Sir, because for us, like we don't have for the oncopathology, we've tied up with a center which is very competent. So we have a young oncologist by the name of Shamit Chopra and his very competent team. He does come down to our college and our postgraduates go there. So, and also he's a regular at our college in terms of the speech opportunities, so that the other specialisms also, gain from him. And for everything, yes, because ours is a smaller center, so we send it to DMC, which is a tertiary center, and our postgraduates are posted there. Rather, one of even for our thesis, we sent her to the Oswald Cancer Hospital, where she subsequently completed her posting also. So that gave a lot of exposure. And another thing, I don't know whether that is relevant here, but if you feel that the examination system, there's no uniformity, I mean, we could go ahead and have a oral pathology competency program, which is, people are going to kill me for that. And see whether how they do, like if you have to go to Canada and you are still a graduate and postgraduate, you still have to sit down and clear that exam, and only then you are allowed to be practicing. So I don't know how much relevance it is. I mean, I'm making a statement, but
I think it's a valid point, Sima. It's a very valid point.
Sima, that is the reason why we started the fellowship program.
Yeah.
Actually, see, that was the whole idea, because it's making a person who's got 15 years training and has never done a competency program or 25 years training, and tell them, please make sure you're competent, is not going to work. There are practical difficulties.
Yeah, and it was like I faced one, sir, and believe me, it really put me on the, we really had to get your documents together. It's a very good way. Yeah.
So the fellowship program was aimed at doing exactly the problem you said. And a note on the programs in the other places like Canada and the US. Well, that's a different issue totally, because the teaching methodology, and I think Raghu made a point of one of that, 6 months, because when I did my master's at Ohio State, 6 months I was totally in general path, and 1 month I was doing autopsies on my own. I mean, it's totally a different experience. So that you cannot do away with, because you need to sort of meet their level of training, and so that's something which is going to be difficult to do, because no matter how you upgrade your program, it's just like having your TOEFL or IELTS to show your proficiency in English language.
Even for their own candidates, like if I have studied in Canada, so I was just going through that. So even if I've studied and trained in Canada, in order to be practicing something, I have to sit in the competency exam. I think then they give you
board certification.
Let me clarify on that, Simarpreet. That's because, and I think Dr. Raghu made this point, the sheer number of pathologists we have is sometimes, a little bit scary. It would be impossible to implement that given the number of oral pathologists we have. Second, that is why you have the system of publications, points, and presentations to ensure this is something like a self-audit. I think all the state councils have this, and all the dental council has this. It is because of the practical difficulty in doing it for the sheer numbers, and who's going to monitor them, who's going to standardize them. So that's why I think correct me if I'm wrong, I think the national board was introduced many years back in dentistry, and then it was taken off because of certain practical issues involved. And you need to, that's why I said, no, to be very careful when we transplant a program from some other country to our country, because the problems we face are a little bit unique to our regional situation. So to overcome that competency, you have the self-audit by, you attend so many training programs, you attend, and you have that in the US. You do not have a competency, but you complete so much of credit as continuous training, what they call the CDE programs. So they don't have a separate exam. Different countries have it in different ways. And as far as India is concerned, that's what we do. You have to accumulate so many points by either publishing articles or attending conferences or doing presentations. That can be fine-tuned. I mean, I totally agree, that can be fine-tuned. And that's there for all specialties. It's not exclusively, oral pathology. All specialties have their own criteria. And you need to take into account the sheer numbers we have. We have like, Dr. Reddy, 365 dental schools. Is that correct?
Yes, sir. It's around 340 dental schools, sir, now.
40 dental schools.
And 175 institutions are offering post-graduation oral pathology, sir.
Something like around 500 and something.
Roughly around 600 postgraduates are passing out every year, madam, actually.
About 575 2 years ago. Now it's 600.
That's just huge numbers. That's just huge numbers you're talking about. And there are a lot of issues with that. But I feel, and once again, it comes back. I don't know who alluded to that point. They were very, very nice in saying that without dotting the I's and crossing the T's, that people join pathology for different reasons. I don't remember which of the panel members said that. That's really true. But there are still a core number, and that's true for most of the specialties. And there are a lot of people who may practice in one specialty and may just do general practice throughout their career. I mean, it's not exclusive to oral pathology. Maybe the percentage is a little bit higher. And people join sometimes to get a master's degree. That's okay. But let's focus on the people who really want to do pathology. And I think somebody once again made the point, I don't remember who. I feel strongly as postgraduate teachers, teaching is important, but the idea is to create a passion in your students so that they pursue that. And if you want to look at how successful the oral pathology program, let's look at this panel we are having here today. You have Dr. Mandana, who is doing something which no oral pathologist has done, who's really taken oral pathology to the masses, and she wasn't trained to do that. You have Dr. Simarpreet, who's involved in so much social work, and I think she's involved in 3 villages she's adopted, and she does work with people working on breast cancer and cervical cancer. You take Dr. Raghu, he is licensed for international education. Dr. Ramana Reddy, he's the dean of his institute, taking care of everything. Dr. Jayanthi, excellent clinical pathologist. She's a good homemaker. She's got 2 kids. She takes care of them. She practices. She teaches. She conducts coaching courses for potential people who are going for postgraduate exam. Dr. Madhura actively involved in research. Dr. Brendan Dsouza has his own lab. Whom did I leave? Ravi, he heads his own department, and he's a jack of all arts. He does so many things so well. So with the programs have been successful. I mean, you can't take it away. And if you look at it, the common thread is each one has pursued something more than what they have been taught at the institution level. I think that's the take-home message you have to take. So each of us have branched out in different methods, different areas, different arenas. And you were not taught this to do in your program. It took you many years to get there, and you can pass on this benefit to your juniors, to your students, to your colleagues. I think, I think Dr. Mandana, would you agree on that?
Yes, I definitely agree on that. But it's in my nature sometimes to be the devil's advocate. So I will come back to one more thing.
Oh, trust me, you need that. You need that, you need that. Otherwise, we'd all be too complacent.
So, you made a very good point. Both you and Dr. Raghu made a very good point, sir, that, the training you have received, and you are both examples of the fact that you're very successful oral pathologists. Okay. And I'm not talking about your, position in administrative, accomplishments, but as oral pathologists. Now, the hours that and both of you trained outside. Now, the point is, you said we cannot really translate things from one place to another, and I agree. At the same time, there is not always necessary to reinvent the wheel. When we have a system available where we know that training worked, why not modify it and perhaps and try and apply it to our system? We have been constantly saying about how our syllabus is so vast and so all encompassing, but could it be its weakness? Maybe its strength is also its weakness. Is it that it's not telling us specifically, you need to focus here more, you need to learn all this, but this, and really requires your focus? Could we not do that? Could we not say that, okay, you cover everything, but for these things, we need you to do this much? Like you were saying, you have a program that works. When I was in courts, I had a very specific program that worked. We had even oral microbiology actually set up. We had forensic dentistry set up. And I'm sure it's all continuing. And I'm sure everybody, I know Dr. Ravikant has an excellent department. He has a lot of things going. And there are, every one of your departments are doing a lot. It's just that we don't know really about each other's departments and what everything is happening. But to get it to a standard where everyone along the country has it, because I keep getting regularly calls from youngsters who say they are not confident. They want to get into research. They are not confident to get in that basic minimum to sit for interviews. People who want to set up a lab are not confident, are not feeling confident. And it's not all, it's just a few, obviously, from around the country. If you said, how many? You said 500 postgraduates are coming out. So a few is really a very small proportion. But I think we have a responsibility to, however, the smallest proportion. So what do you think, sir? What do all of you think? Can we set in the basic minimum?
So, Mandana, see, the burning question on everyone's mind is oral pathology as a career. I really liked what Jayanthi mentioned in her opening remarks. See, oral pathology as a career is promising, provided the scope of oral pathology is not just limited to teaching. A popular notion amongst the Indian oral pathology community is that teaching is the only viable option, for it obviously brings steady income. But I think as an oral pathologist, it is also important for us to realize that there are 4 disparate yet interconnected strands when you choose this as your profession. And somebody made that point earlier. It's teaching, research, administration, after a few years, and pathology service. Well, not all the strands may be attractive to all. The choice rests on the individual. I enjoyed each one of these strands at different levels. Like when I began as an oral pathologist, I was very much interested in teaching. And I still enjoy teaching, although I don't take as many classes. But over a period of time, when you attend conferences, when you see others' presentations, and when you know that they are doing good research, that is when you come back and then you refocus and then you shift your attention to something else. So it's basically, the question is how you apply the knowledge and skills that you have acquired during your oral pathology training. So for me, my PhD is the passion, hunger, and desire. If you have the PhD, that is the passion, the hunger, the drive to do what you want to do in life, sky is the limit. As Dr. Ranganathan was just mentioning, what you're doing is phenomenal. What Ranga has done for himself is amazing. Each one of us chose our own career because we believed that is what we wanted to do. If somebody is practicing clinical oral pathologist, that's wonderful that he has chosen that strand. I chose the research strand because I felt that is where my interest was. And somebody is absolutely passionate about teaching. So I think it's all about how you apply the knowledge and skills that you have acquired as an oral pathologist. Nobody can really tell you that you become this. I think it's up to us to decide that what is that we want to do in our lives.
Yeah, absolutely.
That is true.
Absolutely. Dr. Mandana, I think I think where you're coming from. Let's look at it in two ways. Okay, look at the oral pathology program as it shows you a list of things which you could do. It's like a menu. Just shows you all that which is possible and gives you an exposure to all that is possible. And it's up to the student to pick it up. Let me give my example actually. We try to do almost everything, cytology, a little bit of forensic, everything. But I've been trained very strongly in clinical pathology and I have an inclination towards dermatopathology. So most of my students would have more exposure to that. I mean, this is the individual style of training, basically on what you like and what you're passionate about. And like Dr. Raghu said, he's very much interested in research. I'm sure subconsciously a lot of his students will incline towards research. And Dr. Jayanthi's student would incline towards clinical pathology. And I can actually give you a classic example. I think as of this batch, there have been about 112 or 114 postgraduates are trained out of Raga's Dental College. From Dr. Vishwanathan, Dr. Saraswati, and when I took over as the HOD. I take a look at that and it's amazing. Some of them have become total clinical practitioners. Some of them have gone totally into teaching. Some people like Dr. Reddy are now totally into administration. And some of them have gone into research. Many of my students are abroad doing fantastic research. And sometimes I feel a little bit, very humble because I'm trying to juggle all the, balls in the air, trying to do a little bit of everything. But these people have gone out and established themselves, you name it. And I know some of my students are doing excellent work in forensic odontology. For example, Dr. Kiran at Shiva. Microbiology, I'm trying to, yes, one of my undergraduate students who worked in the oral pathology department for 6 months, he did an internship. He heads a perio department at Iowa. So I think it's our duty to, like what Dr. Raghu said, expose them to all that is possible. It is unavoidable that each program will have a tilt towards something specific depending upon where you have been trained, but we need to expose them to everything. If you don't have that in your institution, you send them out like what Dr. Simarpreet does for oncology, and let the students decide. And some of my students have gone totally into general practice. And in fact, if you look at the Indian scenario, one of the leading cosmetic dentists is an oral pathologist. Yeah. So so I guess I know where you're coming from, that you need to define, but what we should do is we should define these are all possible in oral pathology. Given exposure, probably not the correct term to use in this pandemic, but make sure that the student is acquainted with all these. And it is unavoidable that each of these programs is going to be tilted towards these 4 things: academics, clinical, research, and administration. That's unavoidable because each one of us are good at doing something. And let the graduates take it from there, and whatever their area of interest is, let them do that. So it is going to be a very Herculean task, to say that let us tell them only learn this, learn that. That's probably not going to be feasible at all. I do understand where you're coming from. It's very, very attractive. It makes everything neat and comprehensive and tied up and saying that only this they should learn, this they should not learn. But having said that, there are certain things which I think was alluded to earlier, like carving teeth and, probably doing routine blood smears. Everything is automated today. And it was implemented many years back because, people were supposed to multitask and they were supposed to do your hematology by manual or semi-automatic methods. So that was unavoidable. But those things can be refined. I totally agree. As we move along, as we evolve, we can lay less emphasis on certain things and more emphasis on certain things. I think that would be a practical way of looking at it. And that's my take on that. I'm sure there are going to be different opinions, but that's my take on that. Please go ahead.
Anyone else wants to say anything? No? So, I guess a part of sometimes a little bit of background.
Jayanthi wants
I'm
to
from
say
the generation, and I'm sure
Mandana?
Ranganathan sir must have heard this, though he had already finished doing his post-graduation. But I think he must have come across this. There was this point of time within our Indian academic circuit where when you did a post-graduation, you were told that there is no way you can earn a postgraduate degree. A postgraduate degree is given, is not taken. Okay. And I always found that very odd because I thought it reflects on the teachers because it says, hello, we can't really train you to be good enough. So we are just sort of going to give it to you. We know. And that essentially says, me as a teacher, I'm not good. You as a student, you are not good. And we're just going to do this thing of, charitably give it to you. Okay, you've been hanging around, coming to college for 3 years. Therefore, okay, take the degree. And I always found this very odd because there has to be a quantifiable level. It's not so much about what you leave, what you keep. I think there has to be a quantifiable. Otherwise, why do we take exams? And I know I said we will not talk about, the method of assessment. So I'm breaking that myself. So the thing is, we have now on this panel, we have people who have been, and actually no one is really just out of college. The panel is actually all senior. So between all of us, I'm thinking that if we had to put together, okay, maybe let it be that we each put together, we have run, I know I have not been running anything for quite some time, but there are colleges that are very successfully training students who come out and who are really good. So what if, and I'm sure every one of us had a way. I had a way. I knew how many postings my students had to go. They went for autopsy. They had to report it. We went for conferences. They were not allowed to hang around. They had to come back and give a report to me. Now that meant, and I must say that was very irritating, I couldn't tell my students to sit for things which I did not sit. So therefore I had to sit for the whole thing. Yeah. And that was not fun, but okay, you can't help it. So I used to have my friends saying, Mandana, let's go out, let's go get the coffee. And say, I can't go out. So you see, I've had all of these things, and I'm sure everybody has had it in different ways, because you can't bring that level of, what I would say, perfection, training, unless you put some of it on yourself. And we have worked it, and it has taken a lot. So what if now we say, okay, how do we draw the line? What if every institute that is actually running a successful training puts up, or maybe even just send it to me, okay, what you are doing? It is all obviously covering the syllabus because that's essential, but you are doing something more than the syllabus to get your students that good. So share that, and we can just make a common share of that. Let it be available, because I know when I just started as a HOD, I went from being an undergraduate teacher to being HOD in courts, which is an extremely well-established and large department. I was very lucky that I could get in touch with Dr. Ramana. Dr. Subramaniam was very helpful and friendly. And I had an excellent principal, the greatest mentor I have ever had. Okay, anyone could ever have, Dr. Subramaniam. So all of them helped me, and then I also knew what I wanted. But it's not going to be always easy, and trial and error takes time. So let's put up all these programs so that those who want to have an access. I'm all about answers. I don't want to go away without an answer. I want an answer.
Yeah, that makes a lot of sense, actually. Just one more thing, last thing, and then I will sort of, stop commenting on it. The point you made, I don't think you can say that anymore. You can't say that you're given a degree.
No, definitely not. That has changed. That has changed a lot. That's
water under the bridge.
Yes.
The examination I'm given to understand, and I think it's going to happen. It may take a few years. We are going to go into a comprehensive continuous evaluation. That's only a matter of time before we take up that. So that will address your concerns about how to improve on the current system of examining the student. That'll come. That'll definitely come. I think steps have been initiated. And so we will be moving towards a continuous comprehensive evaluation. And it's only a matter of time before that happens. But I totally agree. We could share any information that you need, which you think others would benefit from. Sure, we'll do that. Thank you.
Yes. Okay. And I think I'm going to ask Dr. Ravikant. He is very quiet, but always has very good ideas. So yes, Ravikant, what do you think? Anything you want to add here?
Ma'am, I think it's well organized and orchestrated, and finally we understand both the positives and the negatives aspect of it. It is very nice. From my side, I just, which I already mentioned, but I wanted to stress once again, uh, the specialities. In fact, I think we as an individual institutes, because each one of us are having attached with some institute. For example, if we excel in a particular area, microbiology, oral microbiology, for example, okay, this particular institute, I'm not saying institutes, it should be good number of them throughout the country. So similarly in the forensic odontology, similarly the basic oral biology, it's a research area where, because I have encountered many students, in fact, my own students, they are interested in pursuing their career in basic research. But the problem is they find it difficult to identify some institutes which are working in the areas. It's all the focus, no ma'am. That's the major important. The focused areas, if they wanted to work on tooth development, for example, some of the PG's earlier batches, they were mentioned that I wanted to work in those areas because they're saying regeneration of tooth is happening somewhere. Can we do something here in those? I'm just giving an example. So if we actually develop ourselves into the next level of research, then the real oral pathology, the fun of learning, the enjoyment of learning the oral pathology will be, I think that is the end result now. That's what I'm looking at. The present generations have got a lot of opportunities, in fact. And I feel this generation, if they are learning oral pathology, I think it's the best time oral pathology can be learned. And why I'm saying is the technology with which with all this, I think beyond the boundaries of anything, they can pursue their interests, areas of interest. Earlier, it was not like that. We have so many limitations, but now the technology is so vast. If we are interested, I think we can immediately procure those things or immediately venture into those things, or that is going to happen now. So I feel this is the right time. If someone is interested in oral pathology, I think this is the best time they can actually venture in and start exploring this science.
That is very true. And I think every one of us here clearly and totally loves oral pathology enough to have come here. And we are all very optimistic. This is a very optimistic group. The very fact that we turned up, I guess, says that we are very optimistic about what can be achieved. And we totally agree with you, Ravikant. Yes, it is. There's a lot. There's one suggestion from Dr. Sandhya. And she says even undergraduate students should be given oral pathology postings to expose them to various histotechniques and research areas. Actually, some institutes already, of course, have postings.
They have postings.
They have postings, yes.
Yes, we have.
Yeah, as per the Council of India also, madam, actually, we have postings in the Department of Oral Pathology.
Yeah, they are posted in a department, yeah.
Yes. And as far as oral histology goes, and I know this will definitely cause much upheaval, but the very fact that, learning, like Sir said, we need to know the normal to know the abnormal, I totally agree. But do we really need to teach it? Because that's an entirely different thing. When we go for a class, we need to update, even if it is within oral pathology. And the question is, how many things can we really be good at, and how can we really focus at? Is it, maybe we'll have that on another discussion. Is it time we give up oral histology?
Absolutely not. I need to say that. Absolutely not. No, I get where you're coming from, Dr. Mandana. I really understand. See, the thing is that there is a way around this. There is a way around this. You can decide what is the minimum you have to teach the student that you can do. And that's why you have the unit system in all educational institutions. The simple topics which are routine, which haven't changed much, like structure of enamel, dentin, you could ask the lecturers and readers to take. and things which are very, very active, which have got recent advances in the oral physiology and biology aspects, you as a senior could take, so that you give them what is the latest. And you would know the basics, but I do understand that, by giving the basics to the lecturers and readers, you're giving them an opportunity to teach and become aware of that. And it's a win-win situation. And the students are also getting trained. Once again, I know I realized that was a parting statement, but I couldn't resist myself making a comment on that. We may
Your
take it
sound went.
some other.
Oh,
It's
he's
okay now?
audible.
It's audible?
Does everyone have Sir's voice?
Yeah.
Yeah, we
Can
can
hear
hear.
him.
I think your mic is okay. So
I don't have it.
it would be a very, very difficult thing to drop histology. I mean, I know that would. Can you hear me now? My batteries run out of power. I think she's having trouble hearing us. I think she has a problem. Yeah.
I think she has a problem.
Yeah, because he's loud and clear.
Dr. Mandana, are you okay? No, we can't hear you, Dr. Mandana.
Yeah, something is happening here on my end.
Yeah, we can hear you now.
Okay. No, actually,
Okay.
my mic is separate. My ear thing is separate. And I think, I'll
okay.
listen to you through YouTube. No problem.
All right. Yes, you can refine what you're going to teach and who's going to teach. But without knowing histology, it's going to be extremely difficult to learn pathology. It's very, very difficult. Very, very difficult. But I do agree that you could fine tune that. There's room for fine tuning it, definitely. But I think pathologists are the best people to teach histology, because when you know something goes wrong, you can tell them what should be normal. I think there's no taking away from that. Maybe if you talk about tooth morphology,
to teach it. We're good
tooth
people to
morphology,
teach
maybe.
it.
Tooth
Oh
morphology,
yes,
maybe.
morphology. Oh God.
Or maybe.
But-
I mean, once again, that's an administrative issue, so I don't want to get into that.
Yes.
But yeah, and I think it's fun teaching histology. I think many of us would agree with that. No?
Yeah,
Yes.
I
It's-
enjoy it.
Yeah, I think it's
I
fun.
love it, but I don't think.
Morphology, yes, I agree. Morphology, histology, I like. I'll keep.
Yeah, that you should give the younger generation, because you don't want to hold a wax knife or carver if you're not very confident.
No, so I love histology, but I and there are aspects of histology we all love. I think every one of us loves teaching tooth development.
Yeah,
it's just too fun. And I agree with that. And I also have, it's a little stuck up to say I don't think anyone else but us could teach it as well. But the point is, what about all the other little things? How much do we really love teaching occlusion? Like one of our panelists, I think Dr. Madhura said, how much do we really love teaching oral biochemistry, embryology? And it's a big, vast subject. We don't need to give up learning it, but we could give up teaching it more than anything, because then it will get its due from a group of people who can be doing only that.
Yeah, once again, you could utilize the strength of a department. That's interesting you brought that up. I love teaching embryology. That's one of the few things I definitely do, oral embryology, because it's fascinating. I mean, every time I learn to take a class, and I do read before I go to the class, I learn something new. And all the other staff are happy that they've dumped it on me, and it's sort of a mixed reason why I do that, because that's one of the first chapters the students learn. So I think I need to be there and create some passion, so that I think it's my responsibility to do that. I love teaching embryology, by the way. And some people don't. And same way if you take pathology, and if I've been traveling too much, my department has a lot of responsibilities. They threaten me saying that you have to take dental caries. Jayanthi will laugh at that, I'm sure, because it's something which I dread doing. I would do it if I have to in a pinch. But there is another staff of mine who loves taking dental caries. And I said, okay, fine, you please go ahead and take that. So that is the Damocles sword they drag over my head, if I'm traveling too much and don't concentrate too much in undergraduate teaching. So I think you can use the resources of a department, and each of us have varied interests. Some people, and in fact, there are some staff who love tooth morphology in my department, and they would take up arms if I say no tooth morphology. I mean, they just love teaching that. So we are a very diverse crowd. I think we need to respect that. So, and
yes, definitely.
And I think the other way of looking at it is you come into more contact with the students. and you can actually convince how, I think who made that point? Jayanthi, or I think Madhura, as is pathology, so is your practice. We say that like a cliched statement. I think every time you take a class, be it embryology, when I take embryology, I make it a point to tell them why they need to know how the tongue develops and what the anomaly is. And you get a chance to drive in the importance of pathology instead of making it a little bit dry. Which is what will happen if your basic science people take that. I mean, they are excellent teachers. I mean, some of my best things I've learned are from my basic science. But if you need to have clinical application, you need to take it. If you take enamel, how exactly the direction of the rods is going to help you decide your class 2 box in a conservative dentistry. And if you're taking pulp, how pulp is a source of stem cells, which is going to later help in research. I don't think anybody can do that better than an oropathologist. See, that is the place where we actually make it fascinating enough that the student takes an interest to oral pathology and realizes that it's just not looking into slides, seeing the shape of the slide and drawing it in the exam. That's not what pathology is about. And like I said, when I take a class, at least 40% are clinical slides. Once again, that's what I'm inclined to. That doesn't mean everybody has to do that. But the way I look at it is it's a chance for me to actually tell the students how good oral pathology is for the clinical practice. I mean, you could tell that till the cows come home, but actually when you teach them, it makes a very big difference. It makes a very, very big difference. So I think we can have those subjects and still use it to generate interest in oral pathology. I think it's a fantastic tool.
I totally agree with what Sir says, ma'am. Because when we are reading in first year biochemistry, if you ask most of the BBA students, they don't like biochemistry. They think it is most of them. They think it is boring and difficult and tough because, as Sir mentioned, the basic science staff teach only the theoretical aspects of so many different cycles where they have to remember, but no one teaches clinical biochemistry. There is a vast area called clinical biochemistry. Why we learn Krebs cycle? What is the importance of that? What goes wrong in that? And how it is clinically helpful to diagnose or treat or understand the disease? No one teaches us that at the first year level. But like Sir said, even maybe because I was trained by him, whenever I take an enamel class, of course, you explain the histology of enamel. You also tell them what is the clinic, what goes wrong in enamel hyperplasia. So if a patient comes with enamel hypoplasia, how you are going to identify that? You tell them at that level and expose them at that level. So you're making use of teaching histology to generate a clinical interest in the patient and make them understand at that level itself that pathology is a bridge between the basic science and clinical dentistry. We are the trunk of the tree.
But Dr. Jayanthi, part of the reason we can do it better and with more interest is because our basic degree is BDS. So we have all learned the required clinical side. Of course, basic sciences on the medical side also do MBBS and then, but the thing is that MBBS is as a whole not quite a hands-on science like we are. MBBS is a very different ball game. Dentistry is a very different ballgame. So in a way, if you think about it, if we had oral biology as a master's within dentistry, then people would do BDS and then would do oral biology and would have the clinical input. Anyway, like I said, that's another discussion. And I would love to have that with Sir, and we will have another day and we will have another panel for that. And we can air our views on that. It should be interesting. Yes. So any closing remarks before we go? Because I think we have sort of covered everything.
Thank you for giving me this opportunity to share some time and our thoughts with you. Thanks to all the panel members and all the presenters. I thoroughly enjoyed it. Hopefully it's as useful as I enjoyed it, and thank you again for making it possible.
Thank you, sir. It's always fun to sit and chat with you. So one of the things I love about this channel, I have had the opportunity to sit and hold conversations with so many people, which I wouldn't have had otherwise. And, I have everybody's undivided attention, and how fun that is. Whenever I meet Sir in a conference, the one thing that really upsets me is that he's so surrounded by his ex-students that I have to literally fight my way in.
True, ma'am.
So this is good. Yes. Yes. Anyone else wants to say anything?
Thank you so much, ma'am, for giving us this opportunity. And it's really nice of you to hold these kind of oral pathology Tuesdays. I think it's a live discussion and many of us enjoy it. And being a part of it for the first time, I really enjoyed it. And being among all of you, all senior members, it's a great opportunity for us. Thank you so much. And keep continuing the good work.
Thank you. Yes, Raghu, I can see you want to say something.
I just want to thank you, Mandana. I think you're doing a great job through your channel. And I think through your channel, it's payback time for us as oral pathologists. Whatever little that we have achieved is because of this profession. And I think collectively we have a responsibility to pay back to the profession.
Totally agree with you.
I agree. I totally agree with Raghu. So let's, pay back and let's increase our competencies and let's handhold and influence the younger lot. So that's what I feel.
Perfect. Yes, definitely. Yes, Dr. Reddy, you want to say something?
Thank you so much, madam. Actually, I thoroughly enjoyed this program. And thank you so much for inviting me for this program, ma'am.
Thank you. Thank you so much for making the time to join us. You must be very, very busy. Yes, Brendan. Did we give you some of the answers you wanted today?
Yes, ma'am. Yes, ma'am. Definitely. And thank you, ma'am. Thank you for it is not common like for oral pathologists to sit and for someone to have this opportunity to speak, ma'am. Not many people take up, like everyone on this panel, everyone just said ki it is not our oral pathology responsibility towards us.
I keep losing.
It is even our responsibility towards the profession. We have to do something for it. We have to work hard for it. Because when we were not promised jobs when we took oral pathology. Because everyone feels that once we have, the profession is not giving us back. Because I am very junior. I get people who have just passed out and they are just criticizing the profession. See, we are not getting this, we are not getting that. But they themselves don't want to go into it and do something. They just want to sit on the fence and they are just speaking about it.
Very valid point, Brendan. I do agree with you. It's wonderfully put.
Yes, it is. It is totally. So it was really great that we could have you also here. And Dr. Madhura, did we get your points cleared?
Yeah, definitely, ma'am. Thank you so much for involving all of us here on the common platform. I really enjoyed the session. And I think, as pointed out by all senior pathologists, it is a time for us to pay back, and we are all accountable for our younger and then future generation of oral pathologists. So I think, and of course, it was a learning experience as well in different dimensions for us as well. So I think it was a great session and we had a very good interaction.
Yes, indeed we did. Where is Dr. Ravikant? Did we lose him again?
He's there. But
Ravikant, are you there?
Yeah, ma'am, I'm here. A little
okay.
Network, that's the reason I switched off my video.
Okay.
Yeah, ma'am. Thank you very much for bringing this particular idea to discuss about an important aspect of oral pathology. So thank you everyone. In fact, all the senior faculty, I think they put their views in the most systematic manner. I think this is the beginning of it. Let us hope for the continuation of this similar discussions. Thank you, ma'am. Thank you very much.
Thank you, Ravikant. And well, thank you all. But please don't go away anywhere. I just have to. Yes. Thank you all. And this is to all of you for being here, for all your, and as you can see, it is the two different perspectives of the same scene. And today you shared your perspectives, and that's what we need. Different people, different opinions, different ways of thinking, and none of us knows it all. But collectively, we can definitely make a lot of difference. And thank you all for being here. And yeah, now I need to just sorry. Yes, also thanks to all our viewers and a little bit of information for next week. So next week, of course, is Ugadi and the New Year that is followed in most of South India. So for that, I'm also going to take a break. I'm going to give all of you also a break. And so we will not have a live session. Instead, we will have a pre-recorded session. Please log in whenever you have the time on that day at 11 o'clock. One new video will go online and you can just watch it. It'll be very great. And for any of you who have so far been with us and have enjoyed this, if this is your first time and you have not so far subscribed, please hit the subscribe button. When we reach 1,000 subscribers, and you may wonder why I keep asking everybody to please subscribe, but when we reach 1,000 subscribers, YouTube will give the channel a better ranking on the search engine so that more people who put in oral pathology will reach one of our videos. So it's not because I intend to become a YouTuber and get a gold shield from YouTube. We are never going to have millions of viewers. That's not going to happen. The purpose of this is really to promote oral pathology. So yes, I would really like it and be grateful if you can subscribe and tell others to subscribe. And yes, with that.
Thank you, Mandana.
Thank you.
Bye.
Bye-bye.
Yeah.
Thank you, ma'am. Thank you, everyone.
Bye.
Thank you, everyone.
Okay, wait. All right, the stream has ended. Okay, we are not live anymore.